Hi, now let's the second part of the biomedical engineering strategies for cancer. So we will discuss about the grading system of cancer and treatment of cancer. So first, how do we grade a cancer? There is a known as a Tnm staging classification. T stands for tumor, number of tumors. N stands for node, that is a lymph node. So lymph node with the presence of tumor involved. And the M is a metastasis. So this is just an example of a colon cancer for grading and staging of a tumor. So you can see this cartoon that stage 0 and stage 1, the tumors arises from epithelium and start to infiltrate. And stage 2, you see it gets bigger, and you can see even blood vessels, angiogenesis happened. And stage 3, the size of the tumor is getting bigger and bigger. And also you can notice that the nearby so-called this drainage lymph node involved with some tumors. And stage 4 is much bigger, and notably you see this arrow, which means that spread to other organs. So this is an inset showing that it arises from mucosa area where epithelial tissue of the colon, and also submucosa, which is right, the epithelium is on top of the basement membrane, and beneath or on the other side, there involves a blood vessel and lymphatic vessels, which is in the submucosa and also in muscle layer and serosa. So when metastasis happens, this is an example from a colon to lung, not lung, liver metastasis. So you can see this liver lobe. It shows a liver metastasis, which is like a white flower here, multiple liver met or liver metastasis during laparoscopic surgery with a colon cancer. So an example of in this colon cancer case, I bring one table of the staging of colorectal cancer. So what is this Tnm staging? So to determine the disease stage, we measure the extent of the disease. Why do we stage? Because by measuring this extent of the disease for guide management. And you can see a good example here. You see there's a stage 1, 2, there's a subcategory of 2A, 2B, stage 3, stage 3A, B, C as a subcategory, and stage 4. You can see T stage, the number of found tumors, one tumor or 2 tumors, and that's stage 1. If it's 3 tumors, stage 2A, and 4 tumors, stage 2B. And while tumors here, and they're involved in nearby lymph node node metastasis, lymph node involved is 1, and that's stage 3, and number of lymph node involved 2. So at the stage gets higher. And what's important here is no found of a metastasis. And let's look at so-called next stage is once we stage, we know how to guide the management, treatment, and to determine prognosis, which means the predicted course of a disease. So we know from this staging, the likelihood what will happen, what is the disease progression is almost be determined by this prognosis, which is represented here as a 5-year survival, which is very important factor. So you look at stage 1, and after 5 years, over 93% will still survive. So you look at the 90, 80, 70, 60, when stage 3C, where tumor doesn't matter, but if we find there's a multiple involvement of lymph node, then 5-year survival is below 50%. What's striking, you can see here, is here that we don't care about the number of tumor, the number of lymph node metastasis, lymph node involvement, but if we find any distant metastasis, we don't care this T and M, because once we look at the 5-year survival, it's only about 8%. So this is a serious one, and that we define as at stage 8. So here's a quiz. If metastatic colorectal cancer, if colorectal cancer is metastatic or find a metastasis, what would be stage? You don't care about T, and when metastasis is happening, it's always stage 4, and the chance of the survival of the patient will be very, very small. So that's why metastasis is so important in terms of prognosis and even for our future treatment strategies.